Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you.
Okay.
What do you need from me?
Now I need
History?
to know you're here for scoliosis, right?
Yes.
And how old are you?
I am 43.
And you've had this how long?
I've had this. My pediatrician detected it when I was probably about 12, 13. Sent me to an orthopedic surgeon down at Jackson Memorial. My curve was measured approximately 13 degrees, I would say. And they said, you know, sit back, wait, let's see what happens. I was short.
There you go.
I was maybe 4'6", tiny little ninth grader. Came back 6 months later, was still okay, no big change, maybe a couple degrees. They said come back in a year. Hit my growth spurt that year, came back, the curve doubled, was probably 30 some degrees, I remember, went from like 16 to 32, and they put me in a back brace. I went through a couple of those in high school, having outgrown one, and then the second one, and then after the second one, my curve was measured at probably 40 degrees, and they said, well, that's it, the back brace didn't work, and you're a big boy now, and that's it. And I was about 17 at the time, and for the most part left untreated. I think I saw an orthopedist once, maybe when I was 19 or my early 20s. He recommended surgery. I said no thank you. You know, I wasn't in pain or uncomfortable or anything. Nothing was bothering me at the time. So, and you know, the orthopedic surgeon that treated me as a child told me I was borderline. He said a lot of doctors would want to do the surgery. I don't recommend it. I wouldn't do it on you. He was retiring, and I kind of took his word for it. Happy I never did the surgery. But fast forward to my mid-30s, I started feeling uncomfortable, especially when sitting. My neck started to give me a lot of problems. I sing professionally, and my jaw is always very, very, very tight. I have TMJ, it locks and it pops. So that's definitely a challenge when I have to sing, because I have to be relaxed and I'm always stiff. So posture is an issue. So I'm researching for different types of therapies for scoliosis, because all the orthopedic surgeons want to do is cut me open. And I find chiropractors that specialize in scoliosis, and I max out my credit card, and I take 2 trips to Connecticut.
They don't really
specialize in it. No, they specialize in making a lot of money, but not in treating me. So I took a couple trips to Connecticut. I thought it was working, you know, probably more in my head than anything else. I couldn't keep up with with that schedule of treatment and traction and all that stuff. And so I kind of let that go until a couple years later, I saw that there was a doctor who did the same thing now in North Miami Beach. So I started seeing him. I went out and purchased the traction equipment, and fast forward about a year or so, I found myself standing like this. My shoulders were 45 degrees to my feet. I really started having a lot of pain sitting on the floor with the kids, and that became very problematic. Fast forward, I guess, to about 4 years ago now. I was just before I was turning 40. My father met a physician, an Israeli guy, who practices in Pisa. He is a distant cousin of my dad's best friend here in Florida, and he's a rehab, physical rehab type physician. I spent a month there. It was a long time, but that treatment method proved to work. He was able to derotate my back, but again, it was a month. It was about 6 to 8 hours of treatment a day, and it was all electronic stimulation. So it worked. Yeah, I still feel good from what he did. There's still plenty of issues that I have to deal with, and traveling to Italy on a regular basis is just not a practical thing for me. So
you still have a
The hump I have, he didn't work on the S curve because he worked on the problem with me at the time was that the vertebrae or my spine rotated.
Well, yeah, well, that's
So
why you have a hump.
he pulled it, well,
That's the hump.
perhaps, but I was standing like this. So, and he managed to pull my shoulders back.
Okay.
So, but I have a lot of problems with my neck, my jaw, my hip is starting to hurt,
Now,
and
does your arm bother you?
my arm, in recent months, yes, to raise my arms, yeah, my shoulders.
To raise the
Just
arms.
To
What
raise
if
my
you don't
arms.
raise them?
If I don't raise them and I sit like this, I guess they don't hurt me.
Arms okay. Which side is your headache on?
Which side is my headache on?
Your left?
The headache is just like it's not a bad headache, it's not like a migraine
Is
headache,
it
but I
left
get like a,
more than right?
no, it's just like a all-around headache, like a vice kind of. I feel like it's that type of, maybe it's a tension headache.
No such thing.
Stress headache, I don't know.
No such thing. No stress headaches are possible. These headaches are all from structure, ligaments. And you can put your finger on it if you know how to do it, and they are all treatable. But tension headache does not exist. Migraine is from a joint. And what else did you say? Tension?
The TMJ I have, the jaw problem.
The TMJ is a different story. Okay. Which side of your neck hurts the most?
The really down the back, the right in the upper back is very, very painful, and turning my head from side to side is sometimes extremely painful.
Yeah.
In the car, if I have to turn around, my range of motion is not.
Anything wake you up at night?
It's funny, I used to not wake up at all at night, and a couple weeks ago I was finally put on a CPAP machine because I went for a sleep test. I'm tired all the time. I'm constantly debilitatingly tired the last 6 months. I have about 2-3 good hours of wake time a day, and then I'm sometimes taking a nap in the car in a parking lot because I'm just that tired. My friends, and for years my wife told me it sounds like I'm choking in my sleep. So I finally did go for the sleep test. It took 45 minutes for them to put the machine on me, and at 8:30 I was passed out. They said, you need a CPAP machine.
I never believed it.
Yeah, so I never really woke up at night before then. I just wasn't sleeping well. However, now that I'm on the CPAP machine, I'm waking up all the time because it's extremely uncomfortable. And I feel like I'm being strangled and choked at night.
Precisely right. That's right.
So,
All right. Either leg hurts you.
my legs now.
Lower back.
My hip and my lower back, yeah. If I'm in a position, I never played hockey or basketball, but when I tried to play basketball as a kid, I couldn't do it because of the dribbling. If I'm bent over, I can't stand, it takes me a very long time to straighten up. Brushing teeth in the morning, hunched over the sink, it's like, it's painful to get back up.
Are you a religious person?
I'm a cantor for a living, so I'm not non-religious. I'm certainly not a non-believer. I'm not one of these people.
We're going to do a
I
miracle on
believe in
you.
miracles. I definitely believe in prayer and miracles.
We're going to do one on you.
So,
Yeah.
no, I do, yeah.
Okay. Let's start your exam now. Put your hands right here. And open your jaw. Does that hurt? Or is this either one hurt?
When you push, no.
You don't have TMJ.
That's what it's been described as.
You could eat my favorite meal, which is a sausage sandwich.
I can eat, I can chew well. I can't open my mouth is the
You are
problem.
opening it.
It hurts when I open it.
Where?
The action of
Where does it
stretching
hurt?
here.
Show me.
Here, up in here.
Which side?
Tight and it locks.
Which side?
It usually locks and pops here.
See, I don't feel that.
I've learned to manipulate it because I
Go
sing.
ahead, open. They're both moving about the same. All right, chin down. Which side hurts you?
Here.
Oh, it's dorsal. It's not even in your neck. Chin all the way up, way back. And that's good. All right. Chin over here. Oh, where does that where does that bother you? On the right?
It bothers me more when I turn to the left.
Okay, but you're on the right now. What hurts?
It doesn't hurt at the moment.
Well, it should be hurting you right here. This way. Okay, where does that hurt?
It hurts in here.
Down below. I think most of your trouble is the dorsal.
Yeah, turning to the left is much harder for me than turning to the right.
But it doesn't bother you, though. It doesn't bother you in the
Not
neck.
at the moment, no.
But it has to be.
When I'm sitting for a long period
No,
of
it has
time
to
is
be.
when it really starts to
It
hurt.
has to be right now.
Now it hurts. When you move it,
Right
it hurts.
there?
When I move, it hurts.
Right
yeah.
there?
Yes.
Is that the one?
Yeah.
I know about this one. That's 4, 5, 5, 6. Oh. You go up pretty good, though. Chin up. Way back, way back. Where does that bother you?
In the back.
The dorsal, yeah. Okay. All right. Stand right here. Turn around. Yeah, let's see that. That's good. Just stand right there. Go ahead and bend forward a little bit. You got mostly rotation. This is flat and this is up, which means that vertebra is actually turned this way. Now, we have to look at it under the fluoroscope. We'll find out where the scar tissue is holding it. And then we'll try to relieve it. All right, you're looking good. No problem. All right. So your neck is good. This pain here is not in your neck, it's in the dorsal spine, so it'll be probably 1, 2, something right here. And as this rotates, you're going to feel a lot different. You're going to love it. All right, let's go look at it under the fluoroscope, and I'll try to do something for you today.
Sure.
Looks like we're in the middle of it right there. Yep. Phew. 7, 8, that's what I said. Doesn't look like he's rotated. It's most unusual. I'm going to show you all this.
Is that the hump on the right?
I'm just writing on, sorry. All right, T78 we're going to do first. And are you ready? Oh, I didn't tell you these are shots, did I? Shots are good if they're put in the right spot.
They work, they're good.
Yeah. Well, what's her name looked this bad? Of course, it's a smaller frame, but still.
True.
How's that feel?
Feels like I just got a shot.
Yeah.
I'm generally uncomfortable on my stomach, so
Oh, you are?
yeah, but it's okay.
Well, we did 2 segments today. And I think
I have to say,
it's working.
I have to say, this feels loose.
Yes.
It feels loose. This always feels very, very tight. I tell people like this feels like Arnold Schwarzenegger, and this feels like Pee Wee Herman, and it feels like they're almost in balance. If that makes any sense.
Yeah, it turned already.
So it feels like they're in balance.
Yeah, this bone was flat here. Now it's up, which meant that bone turned inside. It's a 3-dimension turn, though.
Mm-hmm.
You may not see a lot, but it's 3-dimension. The whole thing goes.
I definitely feel the right side is like in a more relaxed state.
I'm waiting for the a little bit longer to see if I get more turn out of it.
Do you think any of this has anything to do with sleep apnea, or has nothing to do with the
Oh,
other?
of course. You can't sleep with this. I don't believe in sleep apnea.
I like this guy.
So what it is, yeah, you're waking up, but they're not giving you the reason why you're not waking up.
The funny thing is, I was never waking up. I guess, wasn't falling into deep sleep because my body kept waking up.
I wouldn't
But
worry
I never
about-
woke up until they put the mask
No,
on.
you can't have that. You got to wake. If you're going to wake, you're going to wake up. Yeah, let's do this again. I don't know. We got enough turn out of that. Anyway, successful treatment. You can turn over.
Okay.
Have a seat, and I'm going to show you this. This is stuff you've never seen, have you?
Not like this.
No.
I mean, I've seen X-ray.
You go to the gym?
I used to. I stopped
Why?
because it didn't feel right anymore.
I agree.
Pee-wee was getting, every time I would do something, this side felt very like getting aggravated, and I stopped. But if I could get back to the gym, I'd be a very happy person.
Right.
At least a little bit.
This is the first one. This is what we were after. You see the bones rotated this way. See this is long and short?
Mm-hmm.
And we want to derotate those. So then it's after the shot. And I don't see that much change, but that's okay. We're dealing with a long-standing scar tissue.
Yeah, sure. Yeah.
So when you're turned like that, I can't get to it. See, here's the problem. When you're turned, you're like this.
Mm-hmm.
So the scar tissue's under here. How do I get to it? I can't get under there. So we do as little as we can to get it to seep down there and do the job. And then over a period of days, it will turn. And then we go for a new target. See?
Right.
Bring that target up where we can get it. Yeah.
It's similar to what the guy did in Italy, just very different and much less time consuming.
Well, he doesn't have the answer, which is scar tissue.
Right.
He's trying to do electrical stimulation, which doesn't work. All right. Just that quick. Look at that son of a gun.
Yeah, you're.
I feel
Take like a screenshot?
I feel a miracle coming
Well,
on.
I'm just taking video. But, I mean, I can take a still picture
That's
on
all right.
this.
We can do it next time.
I got it.
If you have a camera, you could
I
take
have my phone camera.
I just took a picture,
you
still
could take
picture
a
on
picture of
this.
this. You could take a picture of the screen. You got one there too.
Yep.
Hold on. Hey, bring this knee straight up. No, that's your foot.
Oh, okay.
Hold it up. That's it. This one.
I can't, I know you're gonna pull down with it. And it's like right in here.
Okay, what did I do last time?
You put a shot right there.
That was what I should have taken care of.
Yeah, and I was good for about an hour and a half, and then went right back to this. Plus now I have like pain on my ass side.
Let's see. Just relax there, let me have it. All right, you have a inside of the hip joint. That's why you're looking like that. And it's just a little ligament right in here.
Okay.
You can knock it right in. Come on back.
All right. Let that settle down for a second.
There you go,
Check.
Don. I said I love you, but I lied. And I can't understand the words. They don't make
Well,
any
he's hard
sense.
to understand anyway, because
They don't make any sense.
he screams everything, you
Oh,
know?
yeah. Well, he had a duet. This was a duet.
Oh,
This was on the radio.
well, that looks like it's on a planet.
There it is. Huh. There it is, that son of a gun.
Yep.
So we must have done just the hip flexor last time. Okay. One more.
Oh.
Hold that up. Took me all that time to get ready.
Okay.
All right, are you all ready, sir?
Yeah.
You gotta do it. One of those things. Down. The problem is that the needle's so long that
It is long.
it kind of bends in there. You like that?
Doc, if it works, I'll love it.
Yeah, you didn't move at all, so. All right, have a seat. There's two aspects to this. One was this one,
Right.
and one was this one.
Okay.
See how dark that is?
Right.
Damage. But if I hit it right, it'll open right up. Let me know.
Okay.
But these were two different areas.
Better when I come in.
I think so.
Hope it stays that way.
You'll actually pick it up, should improve right along.
Okay. And I'm going back to work, so.
Well, we'll just, you just gotta chase it down, so you come back.
I ain't even know a piece of that white stuff. You can sit down there if you want.
Do I need to take my shirt off?
I don't know yet, he's gonna have to examine.
And we're looking at shoulder and elbow.
Yeah.
And how long has it been bothering you?
Like a month now.
2 months. What about the elbow?
It was same thing. Like a month.
About a month.
What position you play?
Started feeling my pitch.
Centerfield.
My pitch.
And pitch.
I did the same thing when I played little lawn.
How'd you get hurt?
I don't know. I just kept throwing. Just kept hurting.
He's been playing since he was 4, so it's
Since
just a
he
lot
was
of 4.
4.
It's just a lot of playing. He's playing for the high school now, so it's just playing baseball, throwing balls constantly. If it's not a football, baseball, it's lacrosse ball, but he's playing something with his arms
Do
constantly.
they have a timer on that? Time the ball?
Early yard guard? Yeah.
Speed? Well, you gotta stick with that and gradually increase it instead of trying to get real fast. It's not scientific without number that you can go to, and that helps everything. Can you sleep on this?
Yeah.
Does your neck hurt?
No.
Alright. No treatments, huh? Are you on the first team?
Yeah.
There's only one team. What does the coach say?
He said to ice it.
Ice it.
Yeah.
I mean, I've been giving him a leave and stuff to try to, keep
A
him from
leave?
aching, but
Yeah, aspirin's your better drug.
yeah.
Plain aspirin's good. All right, let's see. Let's see the elbow first. Does that hurt anywhere?
Right here.
Where?
Here.
No. Did you lose your grip on it? Okay, so you've lost a little bit of extension. That's a ligament deep inside. Where's my elbow? It's right here. It's deep inside there.
I knew something.
Deep inside, huh?
I knew something was like that.
Yeah, it's unusual. Now, you can have a muscle problem, which means your grip is going to go, but you don't have a muscle problem. I got about a 10 degrees compared to the other one. So, that is a shot if you want it. And it goes way in where the ligament is. But we're guided with an x-ray, so you can see it. All right, let's look at the shoulder. That's all right. Move this one. Drop it in my hand. Hold it right here. Hold it up. I don't know, you don't have a pain here.
Right here.
Right here.
Yeah.
Here?
More like over here.
Well, no. You can scratch your back. It's not your shoulder, so it's up in here.
Sorry, guys.
But you can take your shirt off.
Unzip this guy over here.
Yeah, ice the shoulder, right? Not the shoulder.
Yeah, he was laying on the couch the other day telling me to put the ice here.
Yeah. This is a great examination. If you're normal on this exam, you don't have shoulder. Just stand right here. All right, you want to get this? He's got a curvature. If you're normal on this exam, you don't have shoulder. Just stand right here. All right, you want to get this? He's got a curvature.
So his shoulder's going up.
Left shoulder's up,
Yeah.
right shoulder's down, so that's a curvature right there. And,
I thought he was he's lifting weights. I thought he was lifting weights too much on one side.
that's probably how
I
you
saw
do it.
I saw the side and I said, you can't lift lopsided. You gotta make sure you do it even.
Yeah, well, you don't know that, and it's right here. There you go, that's his problem. T 5, 6, 6, 7, 7, T 1, 1, 2.
And my throat, like, hurts my bicep a lot too.
I think that's from your elbow. Oh, you got T23. So we'll fix that. It's 2 shots for this, and the bone comes right apart. They're nice though, real fast, and very accurate, so you get the result that I'm predicting, otherwise it'd be a waste of time. The neck is okay, I guess. Go ahead, put your chin down. How's that feel?
Good.
Right. And this way. How's that feel?
Good.
No problem?
Nope.
Chin all the way up. Yeah, and all the way down. Yeah, neck looks pretty good. Shoulder's good. So this is 2 joints.
Playing a lot, like Saturday, he's gonna play a double header, doing things like that. Is there some type of exercise or something that would,
Just push-ups and sit-ups and squats. That's all you want to do.
yeah?
Now, if he needs specific muscles to throw a ball, is that what you want?
Yeah.
Okay, then you do lateral raise.
Okay.
Make sure you do a lateral raise up, 100 pounds and up to 100 pounds. Then you do it 8 times only. That way you don't hurt yourself. You'll never have a muscle pain from the exercise if you do it only 8 times. So, and then you can gradually increase the weight. So if you can do it 8 times at 50 pounds, next time do it 55 pounds, 8 times. And then gradually improve like that. But hold this up here. Don't let me push it down. Hold it up. All right, you've got muscle there. That's lateral raise.
How about squats? How many times?
As many as you can handle. I mean, these are things that keep you in condition, especially when you're going to play. If you do these exercises, your body will warm up and you will never get hurt. But if you go out cold, and all they have you do is throw a ball, but they should be having you doing push-ups, at least 10, 12 of those, and squats.
So before he plays, he should do
Before.
push-ups?
Yeah, because it raises the body temperature
Right.
and you won't get hurt.
Okay. So you gotta remember that no matter what anybody else is doing.
But the coach should really come in here with it.
Yeah.
I mean, he's 50 years ago. That's what they did 50 years ago. Ice.
Yeah, I know.
I mean, every time I hear that, I laugh because there's no sense to it. No.
We only did it one day, maybe 2.
Oh, just 1 or 2 days. But no, that's what they're recommending. See, and that's wrong.
They walk around the field with the ice, with the ace bandage like on TV.
I mean, it's really ridiculous. They should listen to my radio show on Sunday. We talk about all this stuff. Okay, shall we go?
Yes.
All right, we're gonna go get the elbow first, then we'll come right back here, or do it over there. And we use a,
Starting to come?
yeah, we did a fancy machine there.
Do you think you need me or you want me to stay over here?
Why?
Huh? Don't move.
That's good advice, by the way.
I like it when the parents come in and they demand performance, like, don't move. We got a couple of girls in here that wouldn't sell.
That's what it comes down
That's
to.
what it comes down to. There we go. Which high school is this? Hardwoods. Where is it? Hardwood? Where is it? Hardwood. Oh, Park? Number one.
You drove 2 hours to get in?
Yeah.
It's worth it though.
Can't do it. I always felt it when I went in.
What?
I always felt it when I went in.
It's straight already. All right. So I think I'll take a look at this. Just turn mine on over. I want to put your chest.
What's that? It's off.
Is this one good? Where?
Just different.
The vertebrae can pull.
This does more for you than it's the curve. And it's the latest stuff. No one in the world does this work. Yeah, the film shows that the T12 was worse than the T34.
Wow.
So we did them both. And it's rotating. You can see the film is rotating. So what I want to do is take another exposure to show you the bone turn.
Yeah.
Yeah, did I store that?
That was gonna ask if you saved it.
Did I save it?
This one right here?
Yeah.
I don't think so.
We'll save it again then.
Maybe you did because that number went on the bottom.
Yeah, this is turned already. This was the, what was causing that curvature. It's up, the left shoulder's up because of this rotation here. And so you have two of them, adjusting the both. And they're straight. See it? You see it? You're straight right out in front of your eyes.
Back. I bet I went to the stupid chiropractor anymore.
My elbow feels so much
Yeah,
better.
It wouldn't.
I know, but
There's no science there.
I know. I got a terrible problem.
Okay, big boy,
My
go
whole-
right on over. Watch the area.
I'm not as good as that one though. I'm terrible at needle.
Yeah, it's 3 seconds.
You got allergies too.
Yes.
The rest of your life,
It's
you
not-
like this soup that we live in is terrible. Well, anyway, that was your elbow there. And then started to see the turn. This bone is short and long. Short and long. And this was pretty good. Oh, maybe I missed it. Go back and get that. Anyway, when you get right down here, you see it's all strong. You like that? That's fantastic. Did you see it?
Elbow hurts so much more worse.
Then your neck.
I need to feel it backwards, just the deal.
Does that mean the neck is this just those pieces even now, or is it still
Yeah,
higher on
they're all
one side?
even now. So his shoulder will come down and it's the end of it.
How's your
You're gonna be
movement for your
okay to go
elbow?
to practice
A lot.
today?
Can you,
Did I see that again? Did you see it?
no.
I can see it going to the
Here's the
left.
first. You see the short?
Yeah,
This is my marker. That's how I mark the stick.
right?
Anyway, this is short and long. The bone is turning.
Yeah.
Short and long. And this one's short and long. I don't think I can get that. Anyway, now at the end of that, you see it's all straight. All those bones return.
Just from a shot from
Yeah.
putting the muscles different?
It's not muscle, it's ligament.
We got it, yeah.
That is the latest and best. That
He's
is
getting the best
world-class
treatment in
right
the world. I mean, nobody,
there.
they don't even do this on the
The
pros.
pros don't get this.
So that's how good this treatment is.
Do you know if the studs are the studs real in your back?
Yeah, there.
Because he told me, the guy told me I had the stud syndrome, which is in the back down here. It's been a long time of baloney. I need to do something different.
Well, that tells you it's baloney.
I know, 'cause
Get
my
well.
back- it
Here
does
you
it.
get- Look at, he's getting well in one day. What day?
Not even.
That's how it was for the other kid. Yeah, well, so I can see what you're smiling. So, okay, so your shoulder's gone down.
I told you that side was up high.
That's great.
Now what?
Well, I'm not at that rheumatoid arthritis. And it's sprained my whole body already.
Doesn't do your whole body. You have to locate it.
Okay, it's more like my joints, my leg, my arms, leg. It's a lot of pain.
Well, pain doesn't work that way. I mean,
Right.
you have to localize it. Which pain is important to you today?
In my bones. A
Your
lot of pain,
bones?
yes. Yes, my bones. Just see how swollen is my arm, and like that.
They're not swollen.
Huh?
They look as good as mine.
What we saying, I don't used to be like this. Yeah.
So what seems to be your problem? Your elbow or your hands?
My hands and my leg. All of my legs, just the pain.
Hands and your legs.
Yeah.
Okay. All right, and what about the legs?
The leg,
Huh?
I still feel it sometimes, night time, like pulling it a bit, but no pain. Like it was no pain. The pain is gone. The pain is gone.
Oh, that pain. But
That
what
pain
else?
gone.
What about this other pain? Where is it?
Like, where's your new pain?
Here, in my leg, here,
In your hip?
yeah, my hips, lot my hips, and my arms.
Saying your hips and your arms.
Yeah, it's more my hips and my arms.
talking about hips, huh?
Yeah, hip, yes, a lot in my hips and my arm.
How do they bother you, the hips? Walking?
Walking, a lot walking, yes.
What if you walk a lot?
Oh, pay for that.
It gets worse and worse?
Yes, oh yes.
Or less and less?
No, worse.
Worse and worse?
Yes.
Relax.
Oh,
What?
yeah.
In this way?
No, not that one, no. Not
Yeah.
that way, no.
Okay, we can take care of this hip pain.
Okay.
You don't have it on that side, so it's only on the right.
More like this one. Yeah.
And see, you can't come up with this, see? It
Mm,
won't come up. This one will come up easy.
yeah.
The problem is right in the hip here.
Yeah. Both hips. I feel it both hips. When I sit down, I feel it there. And when I walk, it's just like blocking there.
Yeah, I get it. Okay. We didn't take an x-ray of this either. Okay, we can take that pain out in the other room there with the machine. This is a poor kid. I was like him at his age, 15, in ninth grade. Could not breathe, couldn't sleep.
That's how I was too.
It's a wonder I got through school.
Yep.
You know, he would have trouble the rest of his life. Oh, I'm on the other one. Did you see that?
Yeah. My mother used to put a pot of water on the heat thing so I would get some moisture, you know, thinking that was going to help me. And then rub Vicks all over me and all that stuff.
They did as well as they knew how to do it.
Yep.
Which wasn't good enough.
Nope.
All right, come on. I remember that. They used to, you know, bake you alive. Like all that stuff.
My dad used to have me eat some Vicks.
Oh.
In a hot tea. They make me a hot toddy, they called it.
Oh.
But I also had, like, you know, deviated septum, so I couldn't breathe out of the right side of my nostril anyway for like 18 years. For that stinking golf club.
Take the bench. How about that? Brady, she does good. In the mood. That hip doesn't show as much
No.
as you'd expect. But, yeah, you can get up. But the exam was good. What? Right here?
Yes.
Where's your wrist?
Yes, my joints, oh, my joints. Oh, yeah.
Your joints are okay. The elbows are okay. This is the elbow. I mean, this is, yes.
Oh, why is that so big?
Well, you use it.
So,
Yes, I came with a lot of pain, and right now, 10 minutes later, the whole pain is gone. I don't feel anything in that, no pain at all.
no pain in the hip?
And the last time that when I came to, my leg, I was limping, I can get off.
How's your wrist?
Still some pain in there, like my bones ache, but it's because my rheumatoid arthritis just.
Well, he said he could look at it, but she's gonna have to come, she's coming back today,
Today,
so you come back with her.
okay then, very good. Maybe he'll be able to do something for me.
Yeah.
Okay then. But
Okay,
everything, thank God,
all right,
God is good.
okay.
Yeah.
Oh, Ada, that's gonna hurt.
Oh, there, doctor, you got it. Oh, Lord. He got in the right place, you know what he's doing.
I know, isn't that's scary?
Yes.
I know what they're doing.
But
I
I love,
got your phone. I got your first.
but I love him already though.
That phone. I'm gonna go sit out in the waiting room.
Okay, then.
Do you want me to take your purse?
Yes,
Okay,
please.
I got it.
Oh, yeah. I'll let him do whatever because he knows what he's doing though. That's the main thing. I've been going through this for 5 years now. With this pain in my whole body. It's been awful. It's the first time I feel better after he see me that day. Oh my God. Oh,
Yeah, gives you hope.
yes, it sure do. You don't want nothing, you're just a hope and he gave it to you.
Yeah.
Oh my God. Done.
That wasn't so bad.
No?
All that worry.
She's little but brave.
Oh yes. When you're in pain, you don't care. You just want to get better. That's for sure. That's it, doctor?
Yeah.
That's it?
Can you move your hands a little better?
Much better already, oh yeah.
That was quick.
Yeah. Yeah, you feel that you start away because you want to feel better. And I know, I will though. I got pain on him though. He's the angel pain doctor.
Yeah. Well, have a safe trip home.
And I will bring more people. I told him already. I bring
Okay.
people already, okay? Thank you so
Okay.
much.
All right. Have a great day.
You too.
Drive safe.
Thank you.
Hi, I'm Dr. Pannozzo. The lesson for today is a knee. Did you know that 100% of the knee pain is outside the knee? That's a good lesson to know. And here's what it looks like, all this blue. It's around the knee, and the inside of the knee has no pain fibers at all. So when you hear that you have to have your knee replaced, think twice.